Now we're trying to move to the next artery, which will discuss its anatomy, and this is the lateral tarsal artery. Of course, anytime you hear tarsal, you know that we are talking about the lower limb. So let's first of all identify this artery. So this is a lateral tarsal artery. Of course, it's an artery on the legs, you know. You could say that it's just away from you. We have the lateral tarsal artery and also have the medial tarsal artery, which are inward, closer to you. Alright. So you should know that it's a branch of the dorsalis pedis artery. Where is the dorsalis pedis artery? Can you see this main artery here? Is the dorsalis pedis, and it gives rise to the lateral tarsal artery. Alright. So we said that it runs laterally across the dorsum of the foot, deep to the extensor, digitorum, brevis. There's a muscle found there, but these pictures are actually directed towards arteries, so you won't actually see them labeling or even showing any muscle. You understand? But we'll get to talk about muscles of the lower limb too. We'll talk about all those muscles. You know, so what's the origin arises from the dorsalis pedis artery. Variation may originate at different levels in different individuals. Do you understand? So junction of the neck of the talus is usually 60% in the world population. At the ankle joints, about 20% of the world population, and distal to the navicular joint, about 20% of the world population. So course, it passes laterally in an arc direction across the dorsum of the foot, lies upon the tarsal bones covered by extensor hallucis brevis and extensor digitorum brevis muscles. Alright. So what are the branches? It contributes to the lateral malleolar network. Okay. So anastomosing with arcuate artery. Can just pause and observe. Anterior lateral malleolar artery. Okay. Perforated branches of the fibular artery. Lateral plantar arteries via the perforating branches. So distribution, it gives blood supply to the lateral aspect of the tarsal bones. It gives blood supply to the intertarsal joints, gives blood supply to the extensor hallucis brevis muscle and the extensor digitorum brevis muscle. So clinical notes, that it plays very important roles in collateral circulation around the ankle and the dorsum of the foot. It's important in maintaining blood supply to the lateral foot muscles and also the joints. So it can be injured in what lateral foot traumas or some surgical approaches. Okay, so that's what we got for the lateral tarsal arteries.